Hi, I'm Dr. Phil Parker. Welcome to this introduction to the lightning process. The story of the lightning process starts 25 years ago in 1999 when I developed the lightning process, but if you see the guitars behind me, it actually starts a bit earlier, because when I was 20, I'd always wanted to be a musician. I'd spent my time becoming a musician, and my mum and dad said to me, you have to have a proper job. So I trained as an osteopath at the same time. When I was 20, all of a sudden my life changed because I severed my left hand. And this is a big deal if you're an osteopath. It means that you can't use your hands, but also as a guitar player, that was really significant. So I said to the doctors who stitched me up, how soon until I can play the guitar? And they said, you will never move your fingers again. And that really wasn't the news that I wanted to hear. So I asked lots of other people and they said, no, you won't. I talked to expert after expert and everybody said, this is something you don't recover from. You severed the ulnar nerve, which controls the fine movements of your finger. You won't move your hand again. You'll be left with a claw, a useless claw. And this was very important, not just in my life, but also in why the lightning process got designed. Because I thought, there's got to be a way through this. Surely, I thought, as a young 20-year-old, if lizards can regain the use of a tail they drop if they're caught by a creature, then surely there must be a way to recover from this. And eventually I found a brilliant physiotherapist who said, yeah, I think we can work together using the mind-body connection, using your brain to change the way your physiology works. I was like, yeah, I'll do whatever I need to do. And I worked with her and I did recover the full use of my fingers. I did play guitar even with Eric Clapton, record lots of albums, and probably more importantly, it got me really fascinated in how much potential we have to make change using this extraordinary relationship between how our brain affects our body and how we can affect our brain. And that went on to build what was to become the lightning process. So as a practitioner, worked clinically as an osteopath, working physically, and I realized there was a chunk of things I could help, and there was also other stuff that, although people had symptoms that were physical, it was probably because the rest of their life wasn't working so well. But I didn't have the skills to deal with that. So I retrained in NLP, Ericksonian hypnotherapy, eventually did a PhD in psychology. And I put all those things together and came up with the lightning process, which is really for people who are stuck. And by stuck, we mean they really want to get well. They've tried lots of things and there doesn't seem to be any options that work. Keep on trying, they keep on trying, they keep on getting knocked back. And that actually was the client group I used to see. I used to see a lot of people who were stuck because my osteopathic colleagues would send me their clients that weren't responding, and so would my psychotherapy, hypnotherapy, NLP coaching friends would send me their clients that weren't responding. So I combined these things, and that helped me to devise the lightning process. So that's the history of it. That's why there are guitars behind me. That's a bit about me and my background. So what do we need to know? We need to know what is the lightning process. So what is the lightning process? Well, it's a training program. That's the first thing. So when you see a practitioner, the practitioner does not fix you. That's not their role. Their job is to teach you. Because if we're looking at how your brain influences your body, then the person to be in charge of that is you. So teaching you skills so you can switch different pathways on inside your brain that will change your physiology. I'll come to the research into this in a minute, because a lot of people say, well, that sounds very interesting. Is there anything to that in terms of the science? The answer is yes, there is so much science. Over the last 50 years, the amount of research being done on this is extraordinary. And I'll point you to a page that links to some of the background research of the lightning process and also the research into the lightning process itself. So the person that can most influence this brain-body connection is you, by changing the way you use your brain. So the lightning process is a training. So it has 3 phases. Phase number 1. Phase number 1 is listening to an audio which talks you through some of the stuff I just talked about. Like, okay, so what is the research into how your body is influenced by the way you use your brain? What is that? How does that work? What's the mechanisms that are going on? What's the evidence for this? Well, there's lots of evidence of cellular change, changes in hormones, changes in blood pressure, changes in immune system function, and so on, as a result of how we're using our brain. So the first part was an audio, listen to at home. It's called part 1. That's about 4.5 hours. It takes people through this journey from, this sounds a bit strange, or maybe that sounds interesting, to, oh, that makes perfect sense, I understand. and starts to get them thinking about how they could use these skills to get a sense of change. So very often when people listen to that part 1 audio, they go, oh yeah, things are improving. I'm getting a sense that I can move forwards. Next bit is then moving on to the seminar. It's a three-day seminar, 3 afternoons, about 3.5 hours, on consecutive days, so like a Monday, Tuesday, Wednesday. And in the seminar, they're going to get taught a whole bunch of stuff. So before they do the seminar, there's a little conversation they have with their practitioner just to check, does this make sense to you? Are we on the same page? Is this useful for you? Does this feel like this is going to be a good fit for you? Because we really want people to move on to that training. Much like if you go to university, you need to kind of be in the right space to get value from it, to make sure people are as ready as they can be to get the benefit of attending that training program. Then they do the training program. It's with a practitioner. It can be on Zoom, can be physically in a room as well. And usually it's very small groups, 4 or 5 people with a very experienced practitioner who's been practicing for a long time, but also often has a personal experience of being ill and getting well. Out of all the people we see in the Lightning Process in 25 years, has seen over 25,000 people. A very small percentage of them decide, now I'm well, I want to become a Lightning Process practitioner. So a lot of people who become Lightning Process practitioners have either been through the process or know someone who has, and they're like, wow, that's amazing, the change that I've seen. So they have some kind of direct experience of what it's like to be on both sides of the conversation, to be someone who's ill and doesn't know what to do, or seeing a close friend or a loved one who's ill and seeing that change, and also being a practitioner. Not only are they Lightning Process practitioners, they've done a very intensive training program to be that, but they also are really skilled therapists. So they study a lot about anatomy and physiology and approaches within psychotherapy and change, particularly looking at coaching, NLP, Ericksonian psychotherapy. So a broad understanding of resolving conflict, helping people deal with trauma, understanding how beliefs work, and the whole gamut of that, as well as being Lightning Process practitioners, because training to be a Lightning Process practitioner is a kind of postgraduate course after having done all that. So they're very experienced, very skilled, very kind practitioners. So they work with you in this very small group, and the structure is on day 1, they'll teach you some stuff about, okay, how do we make change? How do we start to use our brain to change our physiology? I guess I should talk a little bit about how your brain changes your physiology. A couple of really good examples. If you know anyone who blushes, then as soon as they are embarrassed or feel weird about something that makes them feel ashamed or stressed, as I did when I was a kid, their face flushes. And what causes their face to flush? Well, it's a dilatation of the capillaries near the skin. So that's what gives that bright red that you have when you blush. So there's a physiological change in the diameter of the blood vessels in their skin. What's causing that is their brain, and what's triggering their brain to do that is what they're thinking about. So we've got a direct link between where we're pointing our brain, what thoughts we're having, and a physiological change. If we look at placebo studies, there are literally thousands of placebo studies. And placebo studies, you've got maybe a drug or an intervention. Now you contrast it with if we just give a dummy pill or a dummy intervention, including dummy surgery, they've done it without, certainly dummy injections, dummy pills, to find out what happens if you just give the pill with nothing in it. What they find is when you give the pill to somebody that has nothing in it, it will have some of the effect of the actual pill you're testing. So if you say that this is for headaches, probably 30% of people's headaches will disappear taking the placebo. People have been very interested in placebos for years, particularly as a researcher, and I am a researcher. They're kind of a little bit annoying because you have to think about them as you do your statistics. But from a Lightning Process point of view and from a kind of healthcare point of view, we should be fascinated by them, because these are great examples of people making extraordinary changes. And it's not just with headaches. Parkinson's responds very effectively to placebos. MS has some good responses, as do heart disease issues. There's a whole range of things that people respond to that you would think can't change just by thinking differently, and it can, because the way you think affects your brain, and that affects your body. And that draws me to another really important thing. As soon as we talk about the brain-body connection, and particularly the way you're pointing your brain, what you're thinking about, how you're using your brain, people often say, are you saying then that my issues are in my mind. It's like, no, that's really not what we're saying. What we're saying is the issues are in your body, but maybe the solution is to point your body in a different way, to steer your physiology in a different way. And the kind of changes that people have found through research that you can make to your immune system. For instance, Davison's very famous study where he looked at people who are very experienced meditators, found there are changes in their brain, changes in their immune system. But there's also simpler ones. People recalling a happy time experience pain differently. People taking themselves back to a really positive memory reduce their stress response to shock, change their immune system responses. There's even stuff where they've got people taking a very strong tasting drink and getting them pouring in some immunosuppression, because let's say they're on one of the studies on people having kidney transplants and they didn't want them to reject their kidneys, so you need immunosuppressants. They take the strong tasting drink, and what they found is the activity of the cells of the immune system would normally reject that organ reduced, okay, because that's what you'd expect to happen when you take that particular drug, immunosuppressions. They paired the drink and the drug enough times, the smell, taste of this drink and the drug. Then after a while, they could just give them the drink and they would see similar levels of immunosuppression. So in this case, their immune system is responding to the taste of the drink because they've connected the drink and the drug and the experience of drug changes. So many times their brain has started to respond in this way immediately. So let's say there's so much research, I haven't got time to go into all of it, but the body is incredibly responsive to where we're steering it. And the lightning process looks at that. It's like, well, how do we use that? How do we hack into that? How do we help people to really learn how they can steer their brain in a way that's going to improve their physiology? It looks at how our beliefs affect us. So what our expectations are, how that might affect us. We look at how we're talking to ourselves, our internal dialogue, how that might affect us. And we also look at how the conversations we have with other people might affect us, because it turns out the language is incredibly important. Both the internal conversations we have and the conversations doctors, friends have with us about health. We also look at where we're putting our mental attention and focus. Because if we spend a lot of time focusing on pathways and building pathways that take us into bad physiology, it does have a big effect on us. And this is called neuroplasticity, which means the more you use a pathway, the stronger it gets. So which pathways are we building? Ones that take us into trouble, ones that take us into health. And we look at all these things, and we do this on the first day. And as a result, people are like, wow, I've got lots of tools. And then day two, we get them in and we say, right, how are you getting on with that? So we put them into practice. What changes have you noticed? And how can we fine tune this and tailor it so this really works for you? And again, we teach them more skills. And then the same thing on the third day. Been using this for a few days. What are you noticing? What do you need to help with? So supporting them in putting these incredible tools into practice. So the first part is listen to the audio. The second is the seminar. And the third bit is, okay, now you've got the tools, we've got to support you in this. So as you go about your daily life, using these skills, making changes, changing your physiology, improving what you can do, then you're going to need support. And again, the practitioners are there for that. So that's all built in to the lightning process seminar. So the next question people often have about the lightning process is, well, what's it good for? What does it work for? And what is the research? So let's talk about that. So the research into the lightning process. Over the last 25 years, been very keen to get research done. It takes a while if you know anything about research. My PhD specifically was on researching into a version of the lightning process for people with substance use disorders. We did a randomized controlled trial. We found it was better than treatment as usual. But there's been a range of different research projects onto the lightning process. One of the biggest ones was, again, an RCT at the University of Bristol and the hospitals in Bath, looking at people with chronic fatigue. And again, when they compared the lightning process plus standard medical, specialist medical care to specialist medical care on its own, what they found with the group of patients they were looking at, there was a statistically positive improvement. So outcomes were statistically significant better if people took the lightning process. have a look at the paper. It's the Crawley paper. Very, very well-designed trial showing that the lightning process is effective when added to specialist medical care. There's also a range of other studies that have been done that have been showing that for the majority of people who do the lightning process, they get changes. So I'm not going to spend lots of time talking about it because you can read all the research, but there is a lot of research supporting the lightning process. And probably another thing that's worth noting is that in all the studies that have been published, peer-reviewed studies, there is no evidence the lightning process does anything but good, so no evidence of any harm. Because when you think about it, what the lightning process is doing is helping people to be nicer to themselves. That's pretty much a universally positive thing. To talk to themselves in a different way that's encouraging their health, to spend their time thinking about, is the way I'm putting my neurology harming or helping my physiology? And how can I do that? And another big thing the lightning process looks at is, how do you do that? And if you know anything about this kind of work, absolutely essential. How do I have these conversations about how I can make changes? So saying I have some agency, some ability to make change, and emphasizing that this is not your fault that this has happened. So important. And the reason this is so important is twofold. First of all, it isn't your fault this has happened. And secondly, thinking that it was your fault for being ill is not going to help you move forwards. So it's so important to be kind, to recognize that there's no kind of blame involved in this. It's just, okay, this is what's going on in my life. What can I do to make a difference? So moving from this is where I am to how could I influence it? And that's absolutely important, essential, in fact, because as I said, if you want to make change, being nasty to yourself, being hard on yourself is just not the best way. Being kind to yourself, being generous to yourself, being compassionate to yourself, and being optimistic about how you can make change is very important. So, talked a little bit about the research. What about who it works for? Well, we've seen many different people with different conditions, but can broadly put them in two spaces, I guess. First of all, people who come to us with things that we'd consider to be generally physical in the symptomatology. So that's people with pain, people with issues of mobility, coordination, neurological issues, migraines, complex regional pain syndrome, chronic back problems, fatigue issues, very common, long COVID, so post-viral kind of type fatigues, very common, digestive disturbances, a whole range of stuff, helping people to change how their physiology responds, and also autoimmune issues, so people are dealing with that situation where your immune system seems to be attacking your body. That's not an exhaustive list. There's so many things that people come to see us for. And the reason the lightning process seems to work, and this is a question people have, is like, can one thing work for so many things? Well, the answer is the lightning process is a training program that is looking at how do you change your physiology. So if you can find a way to settle and improve your physiology, then there's a potential for it to work for so many different things. Second thing that it works for is people with more emotional, psychological issues, dealing with stuff like depression, anxiety, OCD, eating disorders, and a whole range of that stuff. Because, of course, the lightning process is looking at which neurology you're using. And if that neurology is ones that's churning yourself up or making yourself be hard on yourself or making some decisions that aren't very healthy for you, it could be very useful for that as well. So the range of stuff that the lightning process work for is extraordinary. And as I said at the beginning, you know, people who are stuck. So people who find themselves going, I don't know what to do next. I've tried all the normal things and nobody seems to know what to do. Those are the people that usually come to the lightning process. If you want more information about the conditions that we work with and whether we've worked with the condition you've got, then do get in touch with us. Just send us an email to phil@philparker.org and that'll be picked up by my team. I think it would be useful to just briefly dive into what happens in the lightning process. So we've talked about these 3-day seminars where we're training you in some skills. So what are the skills? Well, the first thing is to understand this whole relationship between how your brain and body works. So it makes kind of rational sense that, oh, I could make a difference. That's a whole piece of what we're talking about. Answering questions, exploring that. Second thing then is, okay, now that we understand there's an option to make a difference to my physiology by changing the way my brain works, how do I do that? And the way we find is best is, first of all, to become aware of what you're doing with your brain. Which way are you pointing it? You're pointing it into areas that are going to create physiological trouble or going to help move your body into recovery. So to become aware of what you're doing, where is your brain going? Because often we're not aware. And people we find come to the seminar say, oh, I'm completely aware of what's going on in my brain. And they find there's areas they didn't even know were issues for them. So that's the first thing, to get an awareness. Once we have an awareness that, oh, hold on a minute, I'm habitually thinking, pointing my brain, changing my physiology in this way, then what we need to do is interrupt that to create some kind of pause or stop. Then, and the pause itself is useful, but what's really important is, what are you going to do next? Because if all you do is interrupt that pattern, it's not really going to change things. So moving from, okay, that's where I'm heading, pausing, interrupting, and then rerouting. And now I'm going to head this way. So working out, well, where do I want to be heading? Having an internal conversation. So we train people to become aware, interrupt, make a pause and a stop, make a choice, and then to coach themselves, to start take a real positive role towards themselves, where any time, day or night, they can have a conversation with themselves that goes, right, well, that's where you were. What do you want to be doing? And how are you going to do it? How are you going to move yourself out of that direction into this direction? To do that, one of the most powerful ways to do it is to spend some time thinking about, well, what does it feel like to feel that I can change? What does it feel like to feel optimistic? What does it feel like to feel energized? What does it feel like to feel deeply calm? So to choose where you're pointing your brain, to kind of go, where do I want to be doing it? And then to do it. And in the program, we train people to do that, to learn how to get calm, how to get energized, how to be optimistic, how to be focused, how to feel like they have power, are empowered in a situation where it feels they don't have any power. And there are many things that people need, and the process is about training you to think, what do I need and how am I going to get it, and giving you a strategy so that you can do it again and again and again and again. So that you start to become someone, instead of drifting in this way because that's what your past has dictated, to start to become someone who chooses which direction you're going to take your brain in. And that in turn influences your physiology, because we know your brain, what your brain is doing, will change what your body's doing. The immune system is affected, the sympathetic nervous system is affected, the endocrine system is affected, and so on. So anything you can do to point yourself in the direction you want to go in is going to have a positive effect. So what else do we need to look at about the lightning process? We can see that if you're a clinician, then referring people might be useful. If you've exhausted all your normal approaches, then the lightning process would be a great place. And certainly for some of these conditions where there aren't many treatments, the lightning process is a really good thing to do early on. In terms of the clients we've seen, over 25,000 people in 25 years, age ranges from about 6 up to over 70, and people with varying levels of severity. So some people who are just about holding down a job but not much else, to people who are being fed through a tube in a darkened room, unable to tolerate light and sound. So the whole range of debility, and also longevity. So some people have had it just for 6 months and other people have had it for 30 or more years. And what we found is it doesn't seem to matter actually how severe, how long you've had it. It seems to be very much about, does this training make sense to you? If you think, oh, this doesn't make sense to me, we would highly recommend don't do the training. Do the training if you think, yeah, this makes sense. This seems to be a good fit for me. So I thought it would also be interesting to talk about what takeaways as a clinician can you have from this conversation. Well, one of the first things is to really think about your language. I'm not going to go into too much detail with this, but because it would take a very long time to talk you through it, but really think about your language, because it turns out the words we use actually trigger neurology and trigger physiology. So for instance, the studies into using the word pain, for example, every time you use the word pain, there is a kind of firing up, according to the studies, of the pain processing centers. Now, if you're someone who has pain, then you're going to be having a lot of internal conversations about pain. You're probably going to be having a lot of external conversations. People will say, how's your pain? Your doctor will say, how's your pain? On a scale of 0 to 10, where 10 is the worst pain imaginable, how much pain have you got? Would you like some painkillers? Now, all these words will trigger the neurology, and remember, from neuroplasticity, the more we use a particular pathway, the stronger it gets. So patients with pain, or chronic pain particularly, are going to have like red hot, fast pathways into experiencing pain, because the more you think about it, the stronger those pathways get, the more it's going to go straight into the neurophysiology of pain. When we think about it, if we give someone analgesia, opiates and stuff, what we're trying to do is sedate those pathways. We're trying to either block the synapses or stop the signals running down those particular pathways. Therefore, we want to think about the language we use. Is the language we use stimulating those pathways or sedating them? Because it doesn't make sense if we're going to be doing a lot of medication to try and get those pathways to settle down and then to be stimulating them at the same time with our conversation. Is that pain better? That really doesn't make much sense. So becoming super aware of the words we use. And one of the things we would recommend as well is thinking about what words are the patient's using. Classically, if any of you have done research, if you ever look at the forms that people have to fill in, the 37 itemized questionnaire about pain is 37 questions about pain. The fatigue scale is lots and lots of questions about fatigue. All these things actually further take us into the neurophysiology of the symptoms. So that's something that needs to change. And when I was doing research, it was almost impossible to find any kind of questionnaires that weren't absolutely rooted in symptomatic language. With your clients, with your patients, just think about that. How much are you using language that is taking them into the wrong physiology without meaning to? It's so common. And think about what words could you use instead. And a key thing is watch out for negation. So quite often you'll hear people say, I don't want pain. And what's interesting with that phraseology is even in the expression of what they want, they're still mentioning the word pain. So training yourself and them to think about, well, what word do they want that doesn't involve the use of the word no. I've talked about pain here, but it's true of any symptoms. The more, of course, clinically we have to talk about symptoms a bit, but we want to move on from that as much as we can to salutogenic language which talks about what do you want, health-giving language, health-boosting language. So that would be my one takeaway. Listen to your language, listen to your patient's language, and think about, all right, I wonder if I could change my part of it, or maybe even inform them about the power of what they're saying to themselves. And within that conversation, which I'm sure you already know, is kindness, the deep importance of kindness, both in communicating that and not being hard on yourself if you find yourself using symptom languages all the time, and remembering that compassion and kindness is so, so important in all interactions, but particularly anything around health. So I hope that's useful. So how can you find out more about the lightning process? If you go to lightningprocess.co.uk, you'll find all the details, research, practitioners, lots of free resources. So you can help yourself on the journey. But I think probably my message after the last 25 years of working in this field is, and it takes me back to my guitars in my hand, is there are ways out of these things. There are more approaches than you might ever imagine. And one of the things I often say to people is, when you get a diagnosis that says there's nothing you can do about it, it might be right, it might be. But what you want to do is ask yourself, is the person that's giving you that diagnosis, have they got the full set of information about all the options available? What they may actually be saying is, the tools I have, I don't think will work for you. And that's quite different to distinguish. And see what you can find out there. There might be things that really do help. And our experience of the lightning process is something that's been so helpful for so many people. But check out the research, get in touch if you want to know more. We're always happy to help, to talk about. We know what it's like to go through difficult times and not know where to turn. So we're very happy to talk and to explain in as much detail as we can what the lightning process is, what it might do for you, what your chances of success with it, because we know this is an important journey and we'd like to support you on that.